Hello, my name is Nicole Maikai-St. And my public health research project is on the HIV disease. Here is the table of contents of everything that I will be covering in this presentation. This includes the background information and history of HIV, the types of HIV, what to do if you have contracted it, the different steps of HIV, some treatment or prevention plans, and the conclusion on how to live with HIV. First, let's talk about this disease. Human immunodeficiency virus, more commonly known as HIV, is a sexually transmitted infection that attacks the body's immune system. HIV is linked to AIDS when left untreated. Next, we're going to get into the history of HIV. According to the Centers for Disease Control and Prevention, HIV comes from a type of chimpanzee in Central Africa, which dates back to the 1800s. The CDC believes that the virus was transmitted when hunting for chimpanzees. As humans came into contact, it spread throughout the infected blood. HIV traveled and first arrived in the U.S. in the 1970s. Some more background information is that HIV is related to acquired immunodeficiency syndrome, or AIDS, which we will get more into later in the presentation. Also, there is no current cure for HIV or AIDS. Once you contract this disease, you do have it for life. Some common flu-like symptoms of HIV include fever, rash, chills, sore throat, swollen lymph nodes, and mouth ulcers. However, some people may be asymptomatic, which makes it really hard to identify HIV without getting tested. The following flu-like symptoms appear 2 to 4 weeks after infection. This is the start of acute HIV infection. Next, we're going to talk about the diagnosis and the different types of HIV. This is a quote from the CDC that states, about 1 in 7 people in the United States who have HIV do not know that they have it. The first type of HIV is acute HIV infection. To get diagnosed, an antibody test or nucleic acid test, or called NATs, an antibody test looks for the HIV antibodies and antigens, while a NATs test is a blood sample. The second type of HIV is chronic HIV infection. To diagnose this, it is the same test as above, but the only problem with this is that the body can take 6 months to 1 year to develop antibodies. The last type of HIV is called acquired immunodeficiency syndrome, more so known as AIDS, and it is diagnosed when the CD4 cell count drops below 200 cells per millimeter. Sadly, the survival rate when contracting this disease and not being treated is an average of 3 years. During this point of the infection, this person will become crucially injured and the immune system will not work. They will start to develop opportunistic infections, or OIs. OIs are illnesses that occur more often or frequently due to HIV. Some statistics that I found relating to gender and ethnicity is that 81% of males have contracted HIV, with only 19% being women. Moreover, according to ethnicity, the highest percent of HIV contracted is through African Americans, with 45%, whites being at 27%, and Hispanic/Latinos being at 24%. Some key numbers to think about with the HIV cases in the U.S. is approximately 1.8 million cases in 2018, 38 million cases in 2019, and 40.1 million cases in 2020 alone. Next, we're going to talk about some recommendations or what medical professionals recommend. The biggest thing is to get tested. The CDC recommends that the ages 13 to 64 years of age should get tested at least once in their lifetime. However, annual testing is preferred. However, people with risk factors are more likely to get infected and should get tested more often, maybe once every 6 months. Some more do's and don'ts when you have contracted HIV is the following. Some do's is to educate your family members and friends about HIV. Allow themselves to go back to work and live. Dispose of any blood products like tampons properly to keep others from getting infected. And have a high protein or high vitamin diet. Some don'ts is to accuse yourself or others for the infection. Do not share razors or personal products with others. Don't expose HIV status to people you don't trust or don't care about. And don't disconnect from the support of others. Pathology, the steps of HIV. The first step of HIV is the early stage. It's acute HIV infection. This is when you are going to develop the flu-like symptoms, like I've said before, 2 to 4 weeks after you have contracted the infection. The next stage is chronic HIV infection. This is when your immune system starts to shut down, but it is still able to fight off some common infections like the cold. This is more likely for you to be asymptomatic. And the last stage is the worst, is acquired immunodeficiency syndrome, and this is the life-threatening stage. This is when your immune system is so damaged that it cannot fight for itself, and you will have an average living of 3 years if you are not put on medication. Treatment. Some treatment plans that you can do include vaccines to keep yourself from getting the virus, microbicides, which is in different forms, including gel, foams, or cream, that people use during intercourse to prevent the transmission, and pre-exposure prophylaxis, also known as PrEP. It is medicine that is blocking the HIV from multiplying. You also take this before having intercourse. Prevention. You want to take precautions like getting tested or using condoms when you have a chance of getting HIV. Some primary prevention is like using condoms or any other thing that can keep sexually transmitted infections from entering your body. A secondary prevention is getting tested. This also works as a primary prevention, however, most people don't get tested until after they have had intercourse. And the last, tertiary prevention, is treatment and pills. This is when you actually have contracted the disease and you need to go on treatment and pills to survive. Lastly, the conclusion. Living with HIV. Staying healthy with HIV is the most important thing a medical professional could recommend. They want you to exercise and keep fit, eat a balanced, nutritious diet, take medication or treatment, and ask support from your friends and family. Spread awareness and help the public health. These are the references that I used throughout my presentation. Thank you.